activate your abdominals, right? So the first thing I want to do is I'm going to want to get that baby into a posterior pelvic tilt so I can lift up, right? I don't want to round the thoracic spine coming up this way. I'm just going to kind of give a little like lift from the pelvis up, keeping their back straight, okay? Then what I'm going to have their head in midline. And I also can use my face, my voice, or I can even use a toy to try to get the baby to attend to the toy, okay? Also, I might want to have the baby reaching up in the middle. So sometimes babies that are just like kind of hanging out with this high guard back here, to get them activated, I might just bring their hands up to try to get them to reach. But basically, I'm going to try going back to this position. We'll get to reaching in a minute. I'm just going to have them in a posterior pelvic tilt right here, trying to keep their head in midline. Now, if they're 6 months, sometimes they should be able to lift their head up off the surface. So what I want everybody to try to do right now, just to get the activation, I'm going to have you lay down on your backs. And what I want you to do is just turn your head to the side and lift your head up off the mat. Then I want you to come back to the center, turn your head, and lift it up off the surface. And we're going to roll to the left, or I might have a toy that they can follow with, okay? So that would be initiating for a 4-month roll. Now, over time, when babies get more balance on their abdominals and their extensors, what happens? They don't always have to bring their knees up. We, as adults, don't bring our knees up, bring our hands, and we roll over. There's different ways of rolling, right? So that's one way for the baby. Now, we're going to also show what I want somebody to do. No. I'm going to have everybody, I'm going to have half the room. All right, let's make this a dividing force. So either come over here or over there. Half the room's going to be lying down. Sure. So if Joan is,
I wouldn't normally do this on an adult, so it's not like.
But if you're going to initiate rolling, and if somebody has some core stability, you're going to be looking to see for flexion of getting our head. So sometimes what happens is the placement of the arm, if it's too high, depending on what Rebecca needs to get that real nice flexion pattern. So it depends where. If she's up there, look what's happening. She's kind of extending, right? Does everyone see that in her back?
Yeah.
When her arm was up here and she was facilitating, she was kind of arching her back and not coming over. For Rebecca, she needed a little more lower down this way as opposed higher this way. So when you're practicing with your partners, you're going to put their arms in different, like high, low, medium, to find where you can initiate them to come up into flexion. The same thing you can initiate with the leg as well. Can you go distally in her do? She thinks she facilitated pretty well.
Can I go distally?
And she's got to work. The other thing is, it's not a bad thing that your patients have to work if they need something to work with. But you'll have to see and play, like I said, it's like a dance of where they're going to need that facilitation at that point. Okay? So what we want you to do is we're going to roll with the baby, right? I might have them inside lying, right? At this point. And I can play with them in side lying, okay? I can then, with side lying, what I would like to do is to be able to get like a nice little chin tuck. Again, we're getting those flexors going. I could put a towel behind them if they don't have a balance, because when you think of it, to maintain side lying, what do you need? You need a balance between your flexors and extensors, right? Because what happens if you don't? The baby can come flying, rolling right back onto their back. So I might just hold them there. I'm going to get a lot more midline play here. I can get a nice little chin tuck here. I can get a lot of nice input into their rib cage. I might even put a hand here. I might want to dissociate their legs. So what their bottom leg is extended, their top leg is flexed, and above their knee, I might just give a little input into their foot so that they can get some proprioception right into there and be able to play. Now, if I wanted to play with the baby and I couldn't have all my hands here, I might put a roll as well to keep them in this position. Some babies might not be able, and they retract their shoulders back. I can come along to try to keep their shoulders protracted so they can play in midline right here. Okay? Once, and we weren't covering this part in lab because we can demonstrate it on the doll. The other thing that if I wanted to do in this before we got into rolling over into prone, I could even play with the baby where I could flex their hip and knee right here. My forearm is going to be on their pelvis, and I'm going to just bring them back and forth where I can work on their flexors and extensors. So if I'm bringing them back, if I'm trying to roll them back, they're going to want to come forward, especially if there's a toy there. I can really get nicely onto their flexors. If I wanted to work and get them back on their extensors and work them in that pattern so that they have to activate it. And they're going to be subtle movements. Like even though I'm showing you big movements on this baby, the best work you can do is when you do subtle shifts, because you have to really activate than these big long excursions, because what's going to happen is they don't have the control and they're just going to collapse. So if you could do small little back and forth, and they're like, oh, where is she going with? And you know, if you were on the ball and someone kept shifting you back and forth on the ball, you're like, whoa, whoa. If someone took you too far back, you're going to fall off the ball. But if they gave small little movements, it's going to make you have to work. Think of it, you know, as an adult, what you would need if your feet were off the floor and someone was facilitating you. Okay? Does that make sense to everybody? Questions? Put traction down on both. My hand can still be on the pelvis. Traction like down at the feet to unweight this arm so that they can come over. Okay?
Yeah.
So the top leg, hip, and knee is flexed. My forearm is on their pelvis. My bottom leg, my other hand is kind of having a hand down the leg into extension. I'm going to actually facilitate forward. When they're almost in like to prone, I'm going to bring my other hand and traction down also with that other leg so it's straight. So this can on-weight this arm. Oh, traction is just like what we were doing before, like just a little pull down into the hip, like down. So the hip going towards the feet, like that.
How does that relate to the arm?
Because if you're doing here, the baby's coming over, I'm not keeping it right here. I'm kind of giving a little lift up and traction down, so it's going to on-weight. So the weight's going back to be able to on-weight the chest area. Okay? And coming back, I'm going to do the reverse. I'm going to flex this hip and bring them back. Once I get into sideline, I might flex this other side to get them to supine. Now, I want everybody to get on their bellies or prone. Just so you the child was on her back for a very prolonged period of time and really hasn't moved a lot.
You want me to go back again?
Yeah. So,
How old is she? She was close to 2 years.
Do you want to sit on the chair here?
Okay, there you go. So right now, if you look at her, right, just even stopping right there, when we talked about the surface, like the support surface, she is just sinking into that surface, right? Like every limb is down on that mat. Again, if you look at her shoulders, when we were talking about reaching up, she's getting her hands where? Where's her arms? Really back here. She's not really coming forward. And you're going forward. That's right. So again, even if what we were just discussing before in sidelining, you also could see that she didn't have the control to keep herself on her side without Deb's hands placement. Again, she's not reaching up, really, at all. Her arms are way back here. She's not even coming forward. And when she is starting or trying to roll, or Deb's trying to get her to roll, look at it. There's no activation of her abdominals whatsoever. It's kind of like she's just really stuck and blocked at that point. Again, her mother's giving her a little nice sensory cueing. Is that a mother? No. See? Okay. And also right there, Deb is having her come back to feel the surface. Again, Deb didn't lift her up off the surface. That's one thing we didn't mention before. Like, you don't want to just lift a child up for the roll. You want them to be able to experience the roll and to use that surface. But you can see right now with Deb, every time Deb would want to go, her head is back. So it's kind of like when she is initiating for movement, it's with extension. Her arm is fully back extended at that period where she can't even come forward, right? And she's not able to maintain sidelining. Look how far back that arm is. And again, this is a child that's kind of like, it's hard for her, it looks like, to move. And if you entertain her with the toy sometimes, children can become very passive as well because you become the entertainment, and that's a lot easier than them having to work at times. So sometimes you have to wait and hold out and see what they will do. So again, notice that she has no connection from her upper trunk and lower trunk and pelvis. She really doesn't even appear to even know those legs even kind of exist. They're kind of just hanging out there. There's no kind of real movement unless Deb actually moves her. So right there, you know, what would happen as a child when they see toys? They get excited, they move and all that. How much movement are you really seeing on her? Okay, the OT there is trying to give her some sensory stimulation to try to see if she brings it in the hands, will she try to reach up for it? And she didn't at that point. And we're going to get to this point also with the facilitation of the PACs.
Okay, you want to stop?
Okay. We could use our face. We also might want to put the baby with the head if we can get a little chin tuck or getting some activation of the flexors. By putting them in a posterior pelvic tilt, we're really getting their flexors moving a little more. If my hands were too much, like I had the baby needed more help up here to reach, I might just use a roll underneath their pelvis to keep them there, okay? Or if I wanted to leave them alone for a little bit and they were playing and I had a mobile here hanging where they can reach, I'm keeping them in that position for it. I could also put a roll underneath their shoulders. You notice how that girl on the tape, she was so far back? I probably would put something behind her scapula to get her arms more to midline so she can get it there as well. And with some of the smaller babies, just doing like a C, I could probably just get the baby here with a C, and I can even get their shoulders this way. And then play with them and get her here. Okay? Does that make more sense to you guys? All right. Let me see on my list of what I'm saying. Okay, and then this was where I can facilitate sometimes even reaching for toys. You think of a 4-month-old, they usually reach up with both hands. 5 months, one might reach, but you want to get them to be able to reach up. You know, also, 5 months, 4 months, you're thinking they're bringing their hands to the knees. By being in this posterior pelvic tilt, they're getting that body awareness, so I can get their hands to the knees right here. I might, if they're not really paying attention, I might be like, woohoo, trying to arouse them and try to wake up their system. Also using their body as part of themselves, bringing their hands to their belly. They're getting that sensory input into their stomach as well, because for the connection to be able to move, you want to be able to have a connection between your uppers and your lowers as well. Okay? Making sense to everybody? And then again, I'm going to, if I look at rolling, I might just go all the way down, get, keep them in this posterior pelvic tilt. Again, I'm not going to round their thoracic spine. I'm just trying to get them into that posterior pelvic tilt so their butt is up off the mat. And then if it was my 4-month roll, I'm going to roll with them. So I don't want to stay right here. I'm going to roll with them, try to keep them in midline, try to go for maybe a chin tuck, go for that dissociation. Here their hands are out, playing in midline, right? Trying to bring a toy. If I needed another roll, I might roll and keep them here. So I can free my hands up here. If they're retracting their shoulder back, I might come on their shoulder girdle. And I might also depress some of these kids that are like stuck like this and have no necks for the longest period of time. I might be able to even get my shoulder down to dissociate their neck from their shoulder and so that they can play. Think of it, if you're like this, how are you going to reach up? So if the kids don't have a neck, I might need to get their shoulders down to free up their neck so they can reach out in space. Is this making sense to everyone? Any other questions? Over to a 6-month where they get that roll and start really working in prone. Now, do I work in prone with a 4-month-old? Absolutely. Do I work with prone with a 1-month-old? Absolutely. So there. And when we get to the facilitations there, rolling can get tricky. How you're going to try to roll, like initiate from the lowers, the uppers, and you're going to get to know your child of what works for them. And when you get out to the clinic, again, it's really dependent on the child. The other facilitations that we're going to be going on after the break is going to be easier to really know where your hand placements have to be to get that kind of movement. Does that answer your question? Make sure the baby's in midline, right? You might want to come along their shoulders just to say, I'm coming up, right? And have it. And then we're going to be on their knees, and so your hands can be right underneath their knees, right? And then you can roll. And think of when you're rolling, look what you roll with the baby. So roll that way, and you're going to go with it. And you might have a toy over this way. You don't want, and it's also the direction of the toy. You don't want the toy back here, because what happens?
Arch their back.
Arching back. So you want to have the toy coming this way, right? And so she can do this. Right, so you could, if you needed to, if the baby can hold this, she has pretty good balance. But what happens when the baby doesn't have it? They a lot of times might roll right back, or might retract their arm way back here. So you could use the roll, right? Okay. I can sometimes this could be enough, or sometimes I might need to, maybe I'll need a little. Now it depends on what my goal was at this time, what I wanted to work on at this point. If I wanted to work on reaching, and I would see, can she reach? Because think of it, this is gravity eliminated now, right? Or if she's retracting back, what would I do? Stabilize her scapular to keep her, and then play with her to play this way. Okay? And then if the baby was small enough, I might be able to dissociate her legs, give a little input here and make sure that this leg is straight, this leg is bent, my hand is over here, and giving input. Okay. Sometimes I might want to even give this is dissociation of the lowers. And then what I might want to do is also maybe sometimes just put my hand on the rib cage to get that nice proprioception, to get that rib cage going as well. And then what you want to do is go to the other side. So you never want to just lift the baby up off the surface. You're going to want to then roll back to the other side. Now sometimes babies have a preference of being on one side, especially if they've been in a hospital for a very long period of time. A lot of times, if for some reason it's always to the right, and they don't want to go to the left. And a lot of it is, there's different theories of why. Maybe in utero, but it's also basically people are right-handed, they always go to the right side of the crib or whatever. But you want to also make sure, and then you can always see that with the flattening of the head and all that. So then you can play with the toy. You could use your face. You could do that. So right now, and look at her. Her head is midline, right? Hands are midline to be able to do play. Dissociation of her legs, if you were going to do that. And then sometimes kids that get stuck with the breathing that they're like this, you might just like a light, not hard. It's just you want to sink your hand in first and then get that. So it's just like this light in and then. I think that's good. Sometimes she might not feel it as well as below, which is right down here. I'm going to again sink my hand into the pelvis, right down the lower torso. And the same thing is once I'm sinking in, I'm going to give the direction for her to lift her head. Now, Rebecca, where did you feel it best? Where? The pelvis. So when we're going to practice this, we have one more before you guys practice. You can tell your partner where did you feel was the best way for the facilitation. Remember, facilitation is getting somebody to want to, oh, they want me to lift my head. They're not actually supposed to lift your head up. It's just a facilitation. The other thing is you can also use toys in this where you can have a mirror right here and have a toy as I'm doing the facilitation too. I don't just have to do the facilitation and not talk to my baby, okay? You could do this with a newborn even to get them to turn their head, okay? But at one point, if a child is on their back and they're not really lifting up, these are two ways you can try to get to facilitate it along with the toy. I could also put Rebecca on an incline, and when you're thinking of an incline, what happens? Your weight is going back towards your pelvis. It's a lot easier to lift your head. So if you're in a hospital setting, you might just raise the head of the bed up a little. And again, you have to be careful with the slide. I'm going to be on the baby, and you're not going to be so far inclined up. But just a slight incline alone, or a plinth if you're in an outpatient area, you can put them on a wedge. And that alone is just distributing their weight back towards the feet, that it's a lot easier to lift the head. Okay? 4 months, what is 4-month-old supposed to do? They're supposed to be able to weight bear through their elbows and really activate their pecs. They're not extending back. If I was at this point to have Rebecca lift up her head, sorry Rebecca, that'll make me do this, just lift up a little. Look at where do you feel it's coming from? Is it more your back? Like you feel like your back?
Yeah.
Okay? And we're going to have everyone do this when your shoulders are behind, your elbows are behind your shoulders and you lift. You're really going to feel like you're just really extending your back, and that's not what we're going to want to do. So where I'm going to want her hand placements is, if she was up to 4 months and not getting there, I'm going to come behind her. And sorry, I'm going to come over this way because she's a little bigger, but you can even come behind the baby this way. She's a little bigger. Again, hands open. My hands are not poking into her chest. I am just coming at her chest, right, facilitating and trying to give, it's kind of like this. Oh, that's good. She still takes much. It's just more like, it's just hands going this way and up. But I'm not lifting her up. It's just going, come on, Rebecca, to get her more active and maybe have a toy here that she would play with. Okay? Because babies want to play. So I'm going to set up my environment, but if I really want her to really push down with her elbows, I might facilitate her to keep her up. Okay? And when we look at the film, I think Deb started doing that on the video as well. Okay? So when you get down, pick a partner, trunk, and then trying to facilitate the head lift, hands down on the bottom, and facilitating. Then just have your partner have your elbows back so you know that this is, if she lift your head up, so you could feel that this is all coming from your back, which we don't want. So for the placements for her to really get active in her pecs and pushing up through her elbows, she needs to be in line, her elbows with her shoulders. Babies, you can always come underneath a lot of times. Rebecca's just a little bigger than a baby. And I'm going to be on her pecs right here. And I'm on her pecs, and it's a facilitation for her to lift her head. Okay? So try that. Rebecca right now, who's my little person. I'm going to have my hands in the direction of where I want to go. Because we're on a plinth, and she's a a little bigger. With a baby, it's going to be a little different. Off the clip. I'm just going to have her come with my hands on the pelvis to facilitate. I might have to get behind her or at her shoulder where she needs to come up. So if I had a side lying, I might have her just having to do this and help her come up. The more that she needs help coming up, I might need to be underneath her. Okay? But it's the direction of the pelvis going towards the point this way. Okay? With babies, there's a lot of ways to get them up. I could also get, if Rebecca, and I can use it on the doll, I can actually get, she's too big for this. I can also have my baby here be up the trunk, and when I'm getting them up, I'm moving. I'm laterally, like kind of weight shifting. I'm totally on their torso, but I'm moving their rib cage and the pelvis at the same time, hoping that when they're weight shifting to this side, the hand comes down, and I'm waiting. And then notice if the baby is weight shifted over here, right? If you weight shift over, what happens? Everyone weight shifted over to the side. What happens? Your head wants to go the other way, back to this direction, so you don't fall over, correct? So the baby that goes up and is weight shifted over here, the head is going to be this way, but over time, the baby, if I kept the baby here, the baby will want to right their head, because what happens? Everyone always wants to go back to the middle. Okay? And once I find the baby's head moving towards the middle, I'm going to move and help the baby come up to sit. Okay? Sitting wise. Before we work on rotation, just come to a posterior. Okay. Right now, Rebecca's in a posterior pelvic tilt. I'm going to ask Rebecca to stay in that position and touch my hand over here with this hand. Go ahead. Come on. Touch. 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 Okay, right? Decide, watch what happens. Touch. Come on. Touch. Right? She's kind of blocked. Now, what do I have to do first before I even do any kind of lateral weight shift? What do I have to change her alignment in sitting, right? So I want to get her pelvis neutral. So I'm going to look to see where she's rounded. I'm going to put for her, oh yeah. My hands, I'm going to put my forearm, you know what, sit over this way because it's easier for me to use my right hand. Thank you. Yeah. So the first thing I want to do is get her out of this. So I'm going to try to see where she's rounded. And again, I'm going to first make contact with her. I'm not just going to shove her. And then my direction is going to be kind of down. Okay? Now what happens sometimes is I can go too far forward, and what happens? Her rib cage is going to go forward. So if that happens, I can just get on her abdominals and give her a little flexion. And I can play with this until I get the neutral pelvis that I want. Okay? With staying with this neutral pelvis, say Rebecca gets blocked and she doesn't know, she only knows sagittal movements, she hasn't done any frontal movement planes. What am I going to do? I could do a lot of things. I can try to get her to weight shift, and I can actually do it almost like this way, like a C. And what I'm looking for is her when she weight shifts to one side. What happens when you weight shift to one side? And you shorten the other side. Okay, so when I shift her over this way, do you notice her shortening is there? So her rib cage and her pelvis are moving together. The other way, when she was blocked, what happens? Her rib cage is moving over her pelvis, which she's stretching the muscles in between, but we're not getting what's a real, true lateral weight shift. And what has to happen before you have rotation? You need lateral weight shifts, thank you. Just like the block, okay? So I can work with her, which is almost like this for the babies, like a C. It's like the happy face, so my hands are kind of going like, yeah, sorry. It's kind of going like this just to get her active. And if she wasn't there, I might have to change my placement of the hands to see where she's blocking, or if she's just collapsing on one side, I might need to help her that she doesn't collapse. If she got better at it, I might have her reach then and come back and reach reach for the toy, and come back. Okay? But I have to be able to have a neutral pelvis. If I keep her back here, and I'm having, come on, reach, neutral, come on, what's wrong? Reach. Now, neutral and just reach. Look at how much more she can go. Okay? So you have to really look when you're doing this, any kind of sitting activities, you really have to look at alignment, right, first. And again, don't make it, sitting up straight doesn't always make it a neutral pelvis, because if I push her really far forward, is this what I want? No. So what can I do? I get on her abdominals, and that's where she is. Okay? Make sense? Rotate and come up to quadruped. So first I'm going to look at her alignment. I'm going to get this leg out, and I'm going to just, I know, I'm going to push this way. You're going to vault over, you're going to vault over this way, okay? I'm going to have my hands on her abdominals. I'm going to guide with my other hand, and I'm going to first have her rotate over, and then I'm going to have her come back. And in this position, I can play with rocking back and forth and get wherever I want to go. I can even go from side to side and play around with it right there. Okay. And then coming back, I'm just going to come back and I'm going to bring her down and over and then up. I should have changed anything on that one.
Can you put her back into front?
Yeah.
Okay, hands on abdominals. Okay, she's externally rotated on the leg that she's going to vault over. My other hand is my guiding hand along her left scapula. I'm just on her. I'm going to rotate her over so she comes down. Then I'm going to come up. I'm still on her abdominals. And right there, I have control over her abdominals. So it's just kind of this, my hand's kind of like shifting like how we were doing it before, but just like facilitating. I'm not shoving her forward. I'm just giving her cueing where I want her to be. Okay?
Was your hands on the scapula of the leg that was extended or the leg that was bent?
My hands is always on her abdominal. I'm just more basically on here, up the scapula, like on her scapular. I'm not on her shoulder right here. I'm like on her scapula, on her left side, if I'm coming up that side. When doesn't everybody try that to come?